Good to see. So I know I can just sense it in the room. We're all itching to talk about clinic, and I have been dying to hear about how it went on your first day, but we are going to save that for Rad Pro because we got more time to discuss it in that class. So whatever your cool stories are, save those, hold on to them. I do want to hear all about them. I want to hear about all of your personal experiences in clinic, but we're going to save that for 1 o'clock today, right after lunch, whenever you're in those nice food comas. So write it down if you need to so you don't forget it. We'll be glad to discuss it. So before we start, a couple things on the agenda here. First off, I do want to get you guys' feedback because I got a lot of feedback from the seniors of using Zoom versus Webex. So I would like to know your opinions because I'm sharing this with Dr. Black. I'm trying to get Zoom approved for everybody because at least from the seniors' perspective, they have shared they prefer Zoom as far as audio, video, and interactivity quality, because Webex has a lot of audio issues and video issues and connectivity issues, at least from what we've experienced. And I would like to know the feedback from you guys as well so I can share that with Dr. Black to get Zoom approved for everybody. So what is your personal opinion on the two programs? Be honest.
I prefer Zoom. I think it's more efficient than Webex. So you have 1 vote for me.
1 vote from Ruth, okay. Thank you, Ruth. Anybody else want to add to that?
I preferred this one as well too. Every time I've done Webex, I've had at least one little moment where like my connection will drop out just a little bit, and I'll miss, you know, maybe 5 or 10 seconds for something. At least the first time we did it, there was no issue with that at all. So.
Yeah, and that's one of the common complaints I've gotten is that people are missing parts of the lecture because the audio is constantly cutting out, and that can definitely be detrimental when you're trying to learn. So great feedback. Anybody else want to add to that? Because I'm taking all this to Dr. Black, trying to sell it to him.
I like Zoom more. I like the fact that you could be able to record the lecture, and I could go back and look into it. On Webex, it's a little difficult to do that.
Very good, very good.
I like Webex. Sorry, I'm like Zoom too, because I get the bad rate when I lack of information, when the connection weak or lose some minute.
Very good, very good. Great feedback.
I usually like miss at least, like whenever we're doing Webex, the connection drops, at least for me, at least like 3 times per class. And to me, that's really annoying and it's frustrating. I can't speak for the rest of my classmates, but I know that's my issue.
I agree with Jonathan and Aurora. Like there's times where you can't hear anything, and then when the audio picks back up, it talks really fast, so you can't really understand what she was saying. And I really like the effect that you can like draw or show us what you're talking specifically.
Yes, I like that too.
And one more thing, like the Webex run now my computer very hot. It make my computer hotter than the.
Oh really?
Yeah, it make my computer like it make me slow down, and it's recommend me like turn off the computer and like participate again. The Webex make me do it.
That's concerning. I haven't heard that yet. That's pretty scary. Yeah, your computer's getting hot. That means it's overtaxing your CPU.
Yeah, that's why.
Oh, sorry. Go ahead, son. I'm sorry.
Just go ahead.
Oh, another thing that happened to me last class was that I couldn't see what Miss Lara was, when she was doing her presentation. I could hear her and I could hear what she was saying, but I couldn't see any of the information that she was providing for us.
Okay, that's definitely concerning. Definitely concerning. So great feedback, guys. I'm going to bring this all to the table because we are going to be having a staff meeting concerning both softwares. And I think it's pretty unanimous because you guys got the same complaints the seniors have with a few new ones. But just quick vote. If you prefer Zoom, raise your hands. I think that's 100%. Okay, so I'm not going to ask about Webex. That's all I need to know. Okay. And everyone has access to record right now if you choose to record. I should have given everyone access to that. Excellent. All right, so we're going to get started today, but right before that, I've got one more thing I want to do because I've gotten a lot of questions about how you put your logs into Trajexis. So I'm actually going to give control to Tracy for a second, and she's going to walk through from a student view because the student view on Trajexis is different from mine. She's going to walk you through really quick of how you go about putting those logs in and what it should look like and what you need to do. So, oh, here you go, Daniel. There you go. I'm going to give Tracy control really quick, let her do her little demo for you guys, and then we'll get right into class. Tracy, I gave you control. Go ahead and do your thing.
All right, so it's pretty simple. Give me one moment. Okay, so this is the Trajexis login, as you can see. One moment. So usually you'll have your normal regular clock in time sheet and everything. You clock into whatever or wherever you're at. Pretty simple. And then usually for the session numbers, it'll be the last 6 digits that y'all have for that day. So you can write, usually what I do is I write the whole thing down just to make sure that I got the numbers correct and everything. And like I double check as I write it down. And for each one, we have a like, let's say I was at Bentop for like today. It's just an example. And let's say I had a session number 116 for, let's say 6, 4, 5, 2, 3. Or okay, so it's the last 5 digits of the session number. What I usually do is write down the whole thing. Make sure you do the repeats as well. Just make sure and indicate that you did have some repeats. The most that we do for repeats are at least 2. The more repeats, it's just like, it's just too many excessive repeats. Other than that, there will be in the next tab after repeats, the supervising employee, which you hold on, give me one moment. Which you put for the tech area, and then that's it.
The tech you perform the exam with.
Yeah, and it's pretty simple. It usually goes by last name, but if it doesn't go by last name, then you can do that, and then that's it.
Okay, that makes sense to everybody. Any questions on that?
Yes, what about because on the Trajexis, you can see the add, like if you want to add more information, more accessions number, you go there and add more. Because that's
Ruth, once you do that, what Tracy said, you will go to add log, and then it'll bring you to a different screen, and you'll have to choose what type of exam it was, what type of x-ray. So let's say it was a lower extremity. You will click lower extremity, and then another pop-up comes up, and it's gonna say if it was like the foot, the ankles, stuff like that. You'll click that. Once you get there, it's gonna bring you to another one, and it's gonna say if you wanna add any additional comments. At that point, you choose to add comments or not, and then you just add it in, and it will automatically populate on the list.
I have a
Another
question
thing,
for
it depends on the department you're in, because I'm in fluoroscopy, and so it didn't ask me like if it was the right shoulder, left shoulder. Like mine, it was a angiogram or arthriogram, something like that. So it didn't ask me what side it was. It just asked me what department it was, which obviously was fluoroscopy studies, and then it just asked me for the time. So it just depends on the department you're at as well.
Very true. Very true. Thank you,
Is
guys.
it,
Thank you,
I'm
Tracy.
sorry. Is it the
Go
last
ahead.
five? Is it the
Go
last
ahead.
5 numbers or is it the last 4? Because when I asked me to log in, I put 4 and it went through.
Go ahead and put 5.
Okay.
Put 5. And make sure, guys, you are writing those entire accession numbers down, because whenever you do image reviews with me or whoever, we got to have that full accession number to pull your exam up. We can't pull it up just on those last few numbers. So the last 5 are only for logging, but keep your full numbers, especially for competencies, so we can pull those up to review them.
And also, don't forget to write down the time, because it asks you for the time as well.
Good point. Thank you. Yes, write your times down. Write everything down. You can't be too thorough, I promise you.
So what about the comments? Is it mandatory? Because do we have to put the comments, the reason? No?
No, it's optional. That's optional. That's just for your own reference, should you choose to.
Okay, but the time will be mandatory.
Correct.
Okay.
Yeah, in the comment section yesterday, I had some foot exams, so I was just putting like left or right and the number of views, just for my own memory. But also another point is my tech that I was with yesterday told me to use the last 4 digits of the accession number. So I think she had just learned that yesterday as well. So I believe you guys if it's 5, but that is a consensus. Everybody thinks it's the last 5 digits of the accession number that we include there.
I've always
Yeah,
been told 5.
Okay. Sounds good.
it's always the last 5 digits, because since that's like the normal amount that we entered in previously when Ashley taught us, that's how we learn. So
Okay.
basically.
Thanks, y'all.
All right. Thank you, guys. Thank you, guys. Appreciate the help there, because we do work through this together. So let's go ahead and get started with methods of patient care. Before I pull the PowerPoint up, though, look at this cool stuff I found. Does anybody remember these? Am I showing my age right now? If you're from the same generation as me, these things were like the most popular thing ever. These are the original Ninja Turtle toys back from the 80s and 90s. I still do have them. One great thing about packing up your house is you find all kinds of stuff you didn't realize you still had. And I have a box full of these things still in my attic. So I found those yesterday. Just wanted to show them to you. And also what's kind of cool is, you know, when you're packing and you find all these old toys, it's like Christmas at your house all over again. My 3 kids have been having like a Christmas toy party at my house. It's been kind of crazy around here. But I've been finding all kinds of neat stuff. If I find anything else cool, I'll show you guys as we're packing. All right, let's pull our PowerPoint up. Okay. Can everyone see that okay? Good, 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 good. So we are going to be starting with aseptic technique, a very, very vital and important thing that we must learn, not only for radiology, but really any area of the medical world in the hospitals. Aseptic technique is vital. And especially, which is kind of disturbing, I mean, we should have been following this all along, but especially with the COVID crisis going on, this has become a lot more predominant because almost everything we're doing is under aseptic technique currently. But chime in really quick. We talked about this the other day on Monday. What is the definition of aseptic technique in your own words? Someone tell me.
Bacteria 100% killed.
Bacteria 100% killed, yes. Anybody want to add to that?
Is it the method of taking all of the microorganisms away?
Good, yes. Both definitions are true. We can put both those together to form that definition and get our full definition of what that aseptic technique is. Now, before I give you that definition, are we all feeling about like this right now? Because I know whenever I was in school, this is usually how I felt. That's a pretty good recreation of me before a test, still to this day. Although I don't smoke, but I do drink coffee very furiously. But if you're not feeling that way, I'm sure at one point you will feel that way, but don't worry, it's totally normal. But back to aseptic technique, let's go ahead and define the word asepsis. And you guys pretty much said this definition right here. Asepsis is the state of being completely, we'll say completely free from disease-causing microorganisms. And you need to make sure you remember, guys, asepsis or aseptic technique falls under two distinct categories. It's going to be medical asepsis, and surgical asepsis. Medical and surgical, they both have very distinct differences. And we do need to make sure we know both of these because, as some of you already know, we don't only perform in the regular department, but we also go to surgery quite a bit in radiology. So we gotta make sure we know and understand both those distinct categories of asepsis. That's also a recreation right there, that cat of me this morning waking up, because it has been a rough week packing and there has not been enough coffee in the world to wake me up this week. But I'm getting there. We're almost done. If I go too fast, you guys let me know. I see some of you guys putting stuff in the chat. I do encourage you to voice your questions unless it's something very private because I can't see the chat while I'm doing my presentation. So I won't be able to see your questions if you have anything you need to say or ask. All right, so aseptic techniques. Typical situations that call for those aseptic measures are, of course, like we just said, surgery. And especially when we talk about the insertion of intravenous lines, urinary catheters, and drains. We're gonna come back to those urinary catheters and talk about those quite a bit because there's a very critical situation when we deal with those urinary catheters. In fact, there's something you're gonna need to write down whenever I come back and talk about that in a second. Now, the two main goals, when we talk about aseptic technique, our two main goals should be, of course, to protect that patient from infection. Especially in this day and age, we should have been doing this all along as healthcare professionals. I will say a lot of people got pretty lazy over the years, but I think this COVID has kind of reignited the need to focus back on this aseptic technique. So we're definitely protecting our patients from those infections, but also we're preventing the spread of pathogens and or any of those harmful microorganisms. That's our two main goals of aseptic technique. We'll be talking about non-aseptic technique as well on the next chapter, and they do have very distinct differences. We need to make sure we know those definitions. That's one of those things that registry does love to ask. So with that being said, big star on that. You want to write that down. All right, moving on. We do have numerous sources of infection. This is also very important to remember, all of these, because I can tell you right now, I do distinctly remember the registry asking all of these or some of these as sources of infection. Write those down, make sure you know what they mean. We're going to talk about each of them distinctively and separately. So of course, we're talking about skin. I think that's pretty self-explanatory. If we have any infection on the skin, that's very easily transmitted. Hair. Hair is a big source of transmission of infection. When we're talking about hair, what do we always have to do before we go into surgery or a surgical case? I do hope, and some of you may have experienced this yesterday, we're putting those hair nets or surgical caps on our heads to protect, especially if you're someone like me where your hair is falling out. You got to keep that hair from falling into the patient, especially if we're doing a surgical sterile procedure. Last thing we want to do is infect anybody with our hair, but that does happen quite a bit. That's why we always wear those caps. That's why we always wear those hair nets before surgery cases. The nasopharynx, I think you guys all know about that nasopharynx by now. That's referring to those infections that are emitted from the nose and mouth, those droplet precautions that we talk about. That's definitely a big source of that infection. Fomites. Do you guys remember the definition of a fomite from last semester? Can anybody give me the definition of a fomite?
It's an inanimate object that has the virus or bacteria on it.
Very good. Inanimate object that is a source of transmission with a virus or bacteria on it. Very good. Very good. Airborne transmission. We all know about COVID right now. That is an airborne transmitted disease. That's definitely a source of infection. Human error. That's a big one, guys. Can anyone tell me, how would human error be a source of infection? What am I talking about when I say human error?
Maybe like touching like a sterile area, us doing like touching it in accident.
Is it the wrong patient?
Both are true. Both are exactly right. We are human. We do make mistakes. Human error is a very, I would say this is probably the biggest issue we have as far as infection, because as you know, whether we're careless or we're just human, mistakes can be made. Did anybody go into surgery yesterday? Anybody? Son, did you touch anything that was blue by accident, or were you very careful?
I try to don't touch anything except the like CR machine.
Good, good. So mistakes do happen. We're moving around the surgery room. We may bump into one of those blue sheets, bump into something that's sterile. And if we do, they've got to redrape everything and start over because it's considered contaminated. That's that human error. We may not see where we're going, might accidentally touch something, we might accidentally transmit something without realizing it. That's that human error. And then cross-contamination. Cross-contamination is a big deal, especially whenever, that's why I put this picture right here. We talk about those urinary catheters. When you get a bladder infection, you're in trouble. And I didn't put this here just to be funny. I do want you to write this down. The infection of the bladder is the most common source of infection in hospitals today. We'll talk about why that is when we get closer to that a little later on in the PowerPoint. But yes, the bladder is the most infected area. It's the most common source of infection when it comes to patients in the hospital setting. And that's mostly due to human error, believe it or not. You hear about people getting UTIs in the hospital a lot. That's because people make errors constantly whenever they're putting those catheters or cleaning them or just using them in that hospital setting. It causes mass infections in the bladder and the urinary system constantly in the hospital. So here's all these things we talked about a little bit closer. Some nice, beautiful pictures of a skin infection. That's obviously why we're donning and doffing. Sometimes we get diseases on our skin. It may be contagious, it may not, but we're going to cover ourselves up just in case. And of course, if we're around patients that do have a contagious skin disease, we want to make sure we're protecting ourselves and those around us by covering up properly. And of course, sanitizing whatever we touch, whether we directly were interacting with that patient or not. Same with hair. Tons of hair infections out there. You're going to see patients that have all kinds of nasty stuff in their hair. If we're around them, whether I touch that patient or not, I want to make sure I'm wiping things down. I'm performing with proper aseptic technique to keep myself safe as well as them and not transmit anything to anybody else. Nasopharynx. People are going to sneeze. It kind of goes hand in hand with the airborne transmission down here on the bottom. Nasopharynx, things are emitted from the nose, from the mouth. When we sneeze, when we cough, those droplets come out. A lot of times it's invisible. Thankfully, I mean, it's kind of nice. Everyone has to wear a mask anyway. So if someone sneezes or coughs, that's being caught in that mask. At least most of it is for the most part. So we are protected from that overall. There's that definition again, guys. This definition is not going to go away. Make sure you commit this to memory because that's not just a Mr. Donahue question. That's another one of those registry questions they like to ask. That fomite or foams is any inanimate object that when contaminated with or exposed to infectious agents can transfer disease to a new host. Commit that to memory. That is a very important definition to make sure you remember. And of course, that human error down there on the bottom right, it's going to happen no matter how careful we are. Mistakes will be made, sometimes intentional, sometimes unintentional, sometimes by accident. No matter what it is, human error is a big deal. The best thing, the best advice, because I guarantee, at least, I mean, all of you here at some point in your career, you're going to break sterile field. You're going to make a mistake. you're going to run into something, own up to it. Seriously, guys, if you're in surgery, if you're in IR, if you accidentally touch one of those blue sheets and no one saw you do it, don't hide it. Don't be like, oh, no one saw me, I can go hide. No one saw it. Oh, it's fine, they can still use it. You may actually injure somebody, infect somebody, or even kill somebody. It's a big deal. Own up to it. I promise you, even if the doctor might curse you out for it, you're doing the right thing. Always own up to your mistakes. That is one of the best pieces of advice I can always give you. Do not hide anything, especially if someone finds out you were hiding it. It can have very bad effects. If you're a technologist, a registered tech working in a hospital, and you try to hide that you broke sterile field, that's one of the quickest ways to lose your job and not be able to get a job anywhere else. Own up to mistakes. Promise you, you're going to make them. Always own up to it. Always tell somebody. Don't ever try to hide anything. Especially this day and age, everything's traceable. Never try to hide anything from anybody. Then, of course, that cross-contamination. Very easy to do. Don't be like this poor nurse right here, where you got sterile gloves on, clean gloves, gown. You put your cell phone to your face. You're transmitting. You're cross-contaminating everything. Silly picture, but believe it or not, this kind of stuff happens all the time. I'd say aside from human error, cross-contamination is probably the biggest thing that people deal with as far as breaking the aseptic technique. Happens all the time without people realizing it. We live on our cell phones. We live on our devices right now. Something we got to take very seriously, and we watch out for that constantly. If you see somebody breaking sterile field or breaking aseptic technique, even if you don't want to say something to somebody, it's usually the right thing to go ahead and speak up and say, hey, I'm not trying to rat you out, but you just contaminated everything. You might need to start over here. You're doing yourself a favor, you're doing the patient a favor, because infections are a big deal. It can actually save somebody's life, for sure. All right, a few more keywords here, guys. Gonna be a lot of definitions this chapter. We have 3 words that people often get mixed up. So you wanna make sure that you are focusing on all 3 of these definitions and you know the distinct difference between all 3. You're gonna hear the words clean, sanitize, disinfect. A lot of people group these into the same exact definition, but they actually all 3 have different meanings. When we talk about cleaning, we're simply talking about dirt and impurities being removed. That's what clean means, simple definition, but it is different from sanitizing and disinfecting. When we say the word sanitize, we are reducing the number of microorganisms to a safe level. We're not completely removing them all the way. That's a key point there. We're reducing the number of those microorganisms just to a safe level. Keyword is a safe level. And then disinfect, it's still not removing everything totally, because no matter how much cleaning you do, you cannot get rid of 100% of microorganisms, although we try to get rid of most of them. The disinfecting is the removal of most microorganisms. How many of you guys have ever used like Clorox wipes or anything like that? It'll say on the bottle, removes 99.9% of microorganisms or bacteria. That's because no matter what you do, you're not going to be able to get rid of 100%, because actually that 0.1% is actually good. We need that. Not all bacteria is bad. Not all microorganisms are bad. Some of those are needed for basic life and survival. So do remember that nothing that we do here is going to remove 100%. Dirt and impurities are removed with cleaning. Sanitizing is reducing the number, and disinfecting is removing most of the microorganisms, but not all. Great way I might ask a question on that for all 3. I might say for cleaning, sanitizing, or disinfecting, true or false? Disinfecting removes 100% of all microorganisms. We would say false, because it only removes most of the microorganisms. So numerous ways I could ask those questions. Do commit those definitions to your memory. Okay, so let's start with surgical asepsis. The definition of surgical asepsis is going to be the protection against infection. Keywords before, during, and after surgery by using sterile techniques. Sterile techniques. When you go into surgery, you're going to see everyone covered up with gloves, masks, gowns, hats. They're practicing that sterile technique. You're going to see the patient draped with all these different blue sheets. There's going to be what is called the sterile areas, the non-sterile areas. If you look at this picture right here, one key thing to remember when we're talking about sterile areas, the sterile area is always from the waist up at the level of the table in a surgical suite. Anything below the waist or below the tabletop is what we call the non-sterile area. You can see this diagram right here. The blue area I'm outlining is the non-sterile area. The red area is going to be the sterile area. Very important to remember that. Waist up and tabletop is sterile. Waist down and below the tabletop is going to be non-sterile area. Even though we're going to go ahead and cover those areas up like we would for sterility, they're not considered sterile areas because there's a lot of things fall down there, a lot of bumping going on. That's why you're going to always see surgeons when they come into a surgical suite, they're just going to keep their hands up above their waists. When they're getting gowned, when they're putting the gloves on, they always have their hands up. They never want to bring their hands down below the waist because that's still considered a non-sterile area. Remember, guys, if you have any questions or comments, chime in. Feel free to. Okay, this is just showing you right here a little bit what that surgical asepsis will look like. I did put this picture in here on purpose, though. You'll notice this is an X-ray technologist because you can see an X-ray tube at the top of your picture here. I do have a question for you guys. There's your X-ray tube, by the way. Is this X-ray technologist practicing proper surgical asepsis? Yes or no? I want you to tell me what's right with this picture or what's wrong with this picture. Anybody?
He should be wearing a gown.
Very good observation. There's no gown on that technologist.
And the tube is supposed to be away in the corner.
Very good. The tube should be out of that picture. The tube should be parked all the way on the other side of the room. Why? Because look how close he is to bumping into that. He's going to contaminate everything if he hits that tube. Anything else?
How about the cover?
Wouldn't the X-ray tube have to be covered to a certain extent as well?
Yes, that is not 100% required within an X-ray room, but I would say yes, because if you ever go into a surgical suite with a C-arm, the C-arm is always going to be draped and covered. But I'm waiting for one more comment here. No one said it yet.
Isn't he supposed to be gowned?
Yeah, someone did say gowned. He isn't gowned.
I think like forgot the apron. Because I went to IR yesterday, and then whenever I got into the IR room, like they always told me like to put the apron on, like in like the everything.
You want the lead jacket, lead apron?
Yes.
Yes. Yeah. Normally you would have that lead apron on under your gown. Yes. Very good. Well, the one I was waiting for someone to say is, I got a question for you. Why the heck is an X-ray tech preparing this guy for surgery? No, the X-ray tech's not going to be doing all that you're seeing right there. This picture, I found this picture and I just laughed at it because this guy is like looking like he knows what he's doing. He's getting that guy ready for surgery, but an X-ray tech's not going to be doing that. That's not going to be your job. Usually a nurse or doctor is going to be actually doing all the draping, getting that patient ready. Aside from, this was not a joke picture. This is a serious picture. I'm like, why are they showing surgical asepsis in this picture? And he doesn't even have a proper gown on. He doesn't even have a surgical gown on. I was like, I got to put that in there and show this to them, see if they can point that out. So that just cracked me up. So you'll never see this scenario right here. If you are seeing this scenario, something's seriously wrong. They should not be doing this, even in an X-ray room like you're seeing right there. That's actually going to be in a surgical suite where the surgeons and nurses are actually getting that patient ready. Normally what your job will be, for those of you who have not been to surgery yet, you're going to be with the C-arm on standby until they call you to come in and take those images that they need for that surgical procedure. If you don't know what a C-arm is yet, I got pictures of what that looks like in just a few minutes. All right, so medical asepsis, a different concept from surgical asepsis. This is the removal of or destruction of infected material. How do we do medical asepsis? Either using that hand sanitizer for 30 seconds or washing those hands for 30 seconds, which we should all be experts on right now. Anytime you wash your hands or sanitize your hands properly, you are performing proper medical asepsis. If you're in a rush and you only wash your hands for 10 seconds, I'm seeing if anyone's looking down right now. If you wash your hands for 10 seconds, you are not practicing proper medical asepsis. It must be at minimum 30 seconds. And also, as you see in the picture on the right there, you've got to scrub every portion of your hands, every crevice, every fingernail, not just do this the whole time. If you're rubbing your hands together, just back and forth, that is not proper medical asepsis. You've got to go all over your hands and wrists, fingernails, corners of your fingers, and then of course, rinse and wipe dry at the very end for that bare minimum of 30 seconds. No one here has done the 10-second hand wash, huh? You're supposed to at least lie and say, no, Mr. Donahue, I'd never wash my hands for 10 seconds. It's always 30 seconds. But you shouldn't be lying. We should all be doing that properly. Whether we have coronavirus or normal times, when coronavirus does eventually go away, you should always do this every single time because, as you should all know, the hospital is full of tons of bacteria, viruses, sick people. I don't know about you, but I don't want to take that home to my family, to my friends, my loved ones. I'm going to do everything I can to protect myself and those around me. All right, so here they are side by side one more time here to make sure we know the clear difference, because simple terminology, but people mix these up constantly. So let's review again. Medical asepsis, we are reducing the number of those pathogens. This is also referred to as a clean technique. And just a few examples is when we are administering medications, enemas, tube feedings, daily hygiene, and of course, we're going to perform medical asepsis when we do what? X-rays. When we do an X-ray in an X-ray room, we should always be performing medical asepsis. And how do we do that properly? Proper hand washing for a minimum of 30 seconds. So surgical asepsis, there is one incorrect thing on this picture where it says eliminates all pathogens. It actually does not eliminate all because there's 0.1% that is always still going to be present, but it's going to eliminate most of those pathogens on the surfaces of the body. Surgical asepsis also goes by the terminology of sterile technique. And they also misspelled that word right there. Do y'all see that? My grammar eyes are really hurting right now. That should be a Q, not a G. It's not technique, it's technique. Sterile technique. And this is going to, of course, be used in our dressing changes, especially catheterizations, because once again, talking about catheterization, that urinary bladder is an area that becomes very infected constantly all the time. And of course, surgical procedures, guys. It should go without saying, when you see the word surgical asepsis, it refers to what? Surgery. Surgical asepsis, surgical procedures. But do know that distinct difference between those two terms. As simple as they are, people are constantly mixing those two up. Okay, so talking about our surgical suites here, guys. Some of you will know what I'm talking about because some of you have already went to surgery. If you have not, you will at some point. Surgery is a very fascinating place. I always refer to surgery a lot as it's almost like a workshop for human bodies because you're going to see all kinds of tools everywhere. It's going to look like a workshop where they're cutting wood and making stuff and welding and doing all kinds of crazy stuff. A lot of the same tools you would see in a workshop, you're actually going to see in a surgical suite. There's people laughing and carrying on, and you would think surgery is a very serious place. Son, I see you shaking your head already. I say the term that people think surgery is a very serious place. Why don't you expand on what I'm about to talk about? Because I think you're about to say the same thing I am. Is surgery a very serious place? Yes or no?
I think half, meaning because like yesterday I listened to rap music in the surgical time.
I was hoping you would say that, son, because yes, most of the time, guys, when you go into a surgery suite, the first thing you're going to hear is they're blaring some rap music, some heavy metal, some rock and roll. The doctors all have their own taste of music, and the first thing they always request is to have their music playing. So people are in there dancing, doing air guitars, they're rapping, they're singing. It's not the most serious place, even though the surgeries may be of a serious nature. So I don't want that to throw you off when you get in there. There's going to be people everywhere. There's going to be blue everywhere. And remember, stay away from the blue. don't touch the blue, or you're gonna have the doctor throwing you out of the room, cursing you out. But it's not the most serious environment that you may have a preconceived notion of. So we do need to know what staff we are dealing with in the surgical suites. Of course, we're gonna have that chief surgeon. He's the one in charge of that whole orthopedic procedure or whatever they're doing. He's the one leading the brigade, because there is a brigade of people in those surgical suites. It's not just one person in there. There's a team of people in there. You have the assisting surgeon. He does just that. He assists the surgeon. He's the one on standby if he needs any help. Most often, this may be a resident, but not all the time. There may be another chief surgeon working alongside the main chief surgeon. You're always going to have the anesthesiologist or the CRNA. Was the anesthesiologist to put the patient to sleep or sedate them during the procedures? By the way, if you want to make the big bucks, guys, become an anesthesiologist, because they make a crud ton of money. Crud ton of money. But from what I hear, they're also the most depressed people in the hospital, and their suicide rates are very high. So I'm not sure why that is exactly, but that's the statistics I read about it. It's also a lot of schooling, You're also going to have the OR nurse or nurses. Usually there's more than one nurse. You're going to have what's called the circulating nurse. The circulating nurse is the one that's usually by the computer. They're getting everyone in the room. They're calling the x-ray tech in. They're getting everything scheduled. They're going through all the paperwork. They're talking about the procedure, making sure that we have the right patient on the table. Because yes, guys, as crazy as it sounds, sometimes they pull the wrong patient in and put the wrong patient on the surgical table. That does happen in real life. I've seen it happen with my own eyes. They also make sure they are operating on the correct body parts. Did I tell you guys about the doctor that cut off the wrong leg yet? We had a doctor at Texas Children's who brought a patient in, and the nurses and the staff didn't do proper identification, which is why we ask you guys to do AIDIT to properly identify. They were in a rush. They put the patient on the table and they amputated the wrong leg. Now, obviously, that person never got his leg back. And I think it goes without saying, that doctor was out of there. This was a child, by the way, because it was at Texas Children's Hospital. This was a child. Patient lost his leg. Doctor was fired, all because they didn't do AIDIT. So as redundant as AIDIT becomes, it is obviously a very serious deal. So that circulating nurse is going to be in charge of identification, getting everyone in the room. They're going to go around the room, ask everyone to identify themselves. It's like they're going to ask you when you're in surgery, who are you? You're going to say, my name is John Donahue. I am a radiology student. That's all you got to say. But they will ask you who you are, because they got to write down everybody that is involved on that surgery. In case something was to go wrong, they'll investigate every person in that room, because yeah, doctors try to cover stuff up if they make mistakes. You may be interrogated at one point about what happened in a surgical procedure. You're also going to have these surgical nurses. What's the surgical nurse's job? To assist the surgeon during the surgery. Also, all those tools, which you see in this picture down here, all those tools, that surgical nurse is in charge of all the tools. They're going to hand them all the scalpels, all the things that open up the patient. I forget the name, that escapes me at the moment. But all those various tools that surgeon needs, that surgical nurse is in charge of that. I put in parentheses sometimes, because it's not always, you'll see a random person in a surgery suite that's called an equipment rep. They're in there to demo equipment in the hopes that the hospital or doctors are interested in purchasing the equipment. So let's say this equipment rep the company invented a brand new scalpel that has artificial intelligence for cutting the patient open. They're going to bring that into that surgery suite and demo that piece of equipment, which is kind of scary. A lot of people don't realize this. They demo equipment constantly on people in the surgery case. You might be a guinea pig during a surgery case. They're demoing equipment to see how efficient it is in hopes that they're going to purchase that new equipment. Residents, there's usually always residents in a surgery procedure, because they got to learn how to do it, just like you guys learn to be x-ray techs. And of course, the support OR staff, that's where we fall. X-ray techs are brought into surgery cases to operate the C-arm. C-arm is a very massive x-ray machine that looks like a C, that runs a fluoroscopy type radiation that you can do video x-rays or still images while they're doing those procedures. So x-ray technologists are very involved on surgery cases, especially orthopedic cases, which means they're dealing with legs, hips, limbs, spine, all that stuff. So you're very involved because you are going to be the eyes of the surgeon. Where that surgeon needs to cut that patient open or drive a nail or a screw into a patient's bone, you are the eyes to make sure they're going in the right, correct area. Now, if they put it in the wrong spot, it's not your fault. You're just the eyes with the x-rays, because that does happen. But you were there alongside that surgeon through that whole surgery case, helping that patient, helping that surgeon see exactly where they need to go for whatever procedure it may be. So it's quite fascinating stuff. You're gonna see some really cool stuff in surgery. And strange enough, I mean, people are actually usually pretty intimidated by surgery. I got a tip for you. 2 years from now, when you guys go to apply for your jobs, one of the best things you can write on your resume is that you're comfortable with surgery. And I'll tell you why. Most new technologists are always put into surgery rotations first because most technologists hate doing it. I never hated it. I always thought it was kind of cool because you get to see some really neat stuff. And you get to be in some really long cases sometimes. You get to know the doctors. You get to see some really neat stuff, learn new stuff. But most people run away from it. The best thing you can do, even if you hate it though, is say that you love surgery and you're comfortable with it. That's usually a huge thumbs up to get yourself approved for a job. Because a lot of people say, oh, I hate surgery, I never liked it. That's usually a big X on that resume. I can tell you because I sat down for a lot of interviews with my former manager. We'd always X out the people that say they didn't like surgery. So something to keep in mind, always push that surgery rotation because that's what a lot of people are looking for in new technologists. So that's just a picture of an X-ray tech right there using a C-arm. It actually does look like a C. That's what's called a C-arm. And this is a fluoroscopic X-ray device. You'll be going in over the patient, around the patient, because the C-arm does rotate around the patient to get those various views for those surgeons and be the eyes during that procedure. Very fascinating stuff. There's just another view right there, that C-arm turned on the side of the patient to obtain what we call the lateral view of that hip. And by the way, guys, if you are squeamish with blood and guts, you're going to see a lot of blood and guts in there, especially with a hip surgery. Let me tell you right now from experience, if you ever walk in on a hip surgery and you're very squeamish with blood, you're going to see a lot of blood. When they cut this open right here, it's going to be leaking like a waterfall of blood all over the place. It's going to get all over your C-arm, which is why it's important to make sure you have it covered like so. Because I can tell you my biggest pet peeve when I was working as an X-ray tech at Texas Children's, so my drawing skills aren't the best. When I was working as an X-ray tech at Texas Children's, my biggest pet peeve was the surgeons or nurses would not properly drape my C-arm right here. They wouldn't put this cover on. This patient's bleeding like a waterfall, and guess where it got all over? It got all over my C-arm. So when I'm doing my procedure, I got to take my C-arm out of the room, go to another area and wipe it down with Cavi wipes, peroxide, bleach. All those little crevices in that C-arm get caked with blood. And if you ever dealt with blood, it dries really fast, it stains. It's a nightmare cleaning those C-arms. So my personal recommendation to you guys is, especially when you become techs, always make sure that C-arm is properly draped. You're going to save yourself a lot of headache, especially when it comes to wiping them down. And I'm sure you guys will experience that with some techs. There'll be lots of curse words flying around because your C-arm is completely drenched with blood, and you probably will be assisting your technologist clean those C-arms off at some point. Just a heads up on that. That's bound to happen. Let's see here. Okay, so one quick video here, guys. Let me pull this up. This is going to show you what it looks like to use those C-arms in surgery, what you can expect when you walk in there, so it's not such a culture shock when you walk in there, because surgery is a completely different world, but something that we all have to rotate through. Whoops. Let's pull it up for you. Any questions so far while I pull this up?
Do you need an extra certificate to use the C-arm?
You do not. You do not. It's a very good question. You will learn to do C-arm from the beginning. You will learn to do C-arm from the beginning, and that's just something that you're expected to know when you become a licensed radiologic technologist. That's a good question.
Like what you're saying in surgery, if the blood gets like on a C-arm, can that cause damage to the machine as well? If too much
Luckily, the C-arms are protected because of the way they're built. It's just more so it's a pain trying to clean them. It drives me crazy. It's a nightmare trying to get all that out of those little crevices. You almost need like a pressure washer to wash it off. It's pretty crazy. Okay, can everyone see my screen? Yes? Okay, I'll play this video for you guys. Make sure, I hope the audio works, guys. Let's see. There's not really much video though, but this is what the surgery suite will look like when you walk into it. And you'll be able to see what the C-arm looks like as well. This guy's gonna get on the table and pretend to be a patient. And you'll see there's a hollowed out area below the table there, guys. That's specifically so you can get your C-arm under there because the C-arm will go around the entire table. It gives you room to maneuver your machine. And those tables do move all around. They rotate. They do some pretty neat stuff. So it's not showing the full capabilities here, but those tables can move in almost every way you can imagine. They're quite amazing to watch. They can put the patient in all kinds of neat positions. That person in the back there, that's going to be that surgical nurse we talked about. She's getting all the tools ready, getting everything ready to go for the doctor. That's going to be the C-arm there, guys. You will be pushing these in and out of surgery. And you'll be coming in and out over that patient during the actual procedures. You do make sure you have that lead jacket on, like you see the tech having the lead jacket on, because these machines do emit a lot of radiation. That's how that C-arm can rotate around the patient. You'll learn how to do this. And you can raise, lower, go in. You can rotate almost any direction you can imagine with that C-arm. Once again, communication. She just asked the doctor, can you raise the table a little bit? Because you can't bring that C-arm any lower than she went. So they're going to raise that patient up to make sure it lines up with that C-arm properly.
You guys want to get behind cover?
You see what she said there? You guys want to get behind cover. You always want to say before you expose, because some people won't be wearing lead jackets, so you don't fry anybody there in the surgery suite. It's all about that communication and being loud, because it gets very noisy in those surgical suites. And that's the screen. It didn't show it very long, but there's a little screen that shows your x-ray images that connects to your C-arm. And that's just a little preview of what you can expect when you go into those surgery suites, guys. So, son, did you get to move the C-arm around any? Did you get to push it?
Yes.
What was it like?
They have the wheel. We can turn around the wheel that different direction, and they have the block in the wheel. So I need to unblock the wheel and I turn around. Yeah. Because like that's a little bit like heavy in the first when we push it. When I push it, but like it moved like very smoothly. But be careful, I don't try to like break everything because there's no more space in the room.
Yeah, so that's a great point Son brought up, because these C-arm machines, guys, because you're all gonna be asked by your techs to help move them, because the C-arm comes in two pieces. You got the main C-arm, which is that C-shaped structure. That's the X-ray machine, but you also have the monitors that connect to it. And I can tell you from experience, these things are very awkward to move. They're easy to get away from you. And you don't want to be like me at Texas Children's and put a hole in the wall, but you can very easily put a hole in the wall with one of these machines. They're very large, very heavy, very awkward to move. So be very careful. And, you know, communicate with your tech. Say, hey, I've never moved one of these before, because you're going to be called to a surgery case. You're going to be rushing in there because they're ready for that X-ray machine. You're going down the hall, and that C-arm gets away from you and it crashes into a wall or through a window. That does happen. That has happened. So if you get a chance, if you get downtime, ask your tech, can you show me how to maneuver the C-arm? Can you give me a demonstration of how to properly move this? And it'll do you a lot of good, I can promise you. All right, guys, so we are going to end right there today. I've only got 5 minutes left. Are there any questions on what we talked about today? Very cool. We've got a lot more interesting things to talk about, guys. We're also going to start talking about some of our practicums coming up. With that being said, enjoy PRE. I do look forward to hearing some of your clinic stories in Rad Pro at 1 o'clock today. So please have those ready to go. I will see you all soon.
I have a question.
Oh, yeah, sure, go ahead.
Yes, is there a way you can send the PowerPoint on the way you used to send it to us for summer?
I don't know. What's it worth to you, Ruth? What's it? Your man hours going to making these PowerPoints. You know how much.
Okay.
No, it's yes, I definitely will send the PowerPoints, guys. I'll definitely do that for you, for sure. All right, guys, enjoy PRE. I will see you all at 1 o'clock. Bye-bye.